disease. The gallbladder is a pear-shaped musculomembranous sac located along the undersurface of the liver. Its function for accumulate and concentrate bile between meals. Gallbladder measures about 7 to 10 cm in length and 3 to 4 cm in transverse diameter. Normal gallbladder wall appear as a pencil-thin echogenic line at sonography. Thickness of gallbladder depends on the degree of gallbladder distensions, and pseudo-thickness can be occur on postprandial state. Ultrasound, CT/MR all allow direct visualization of the normal and thickening of the gallbladder wall. Sonography is used as the initial imaging technique for evaluating the patient with suspected gallbladder disease because of high sensitivity detection of a gallbladder stone and real-time character and speed portability. However, CT has become popular for evaluation of acute abdomen and is often the first modality to detect gallbladder wall thickening, or it may be used as adjunct to inclusive sonography for staging of the disease. Thickness of gallbladder wall measure more than 3 mm. It means that it is thickened. Typically has a layered appearance as sonography, and the CT frequently contain a hypodense layer of subserosal edema that mimic pericholecystic fluid. This schematic for disease of diffuse gallbladder wall thickening. Firstly, cholecystitis. It causes acute calculous cholecystitis, acalculous cholecystitis, complicated acute cholecystitis, chronic cholecystitis, xanthochromatosis cholecystitis, and AIDS cholecystitis. Idiopathic cause adenomyomatosis, malignancy, gallbladder carcinoma, lymphoma, metastatic disease. Systemic اللي هي secondary causes تضمن congestive heart failure, renal failure, liver failure, hypoalbuminemia, and portal hypertension, non-fasting state, physiological contraction. Primary gallbladder disease اللي هي acute cholecystitis تعتبر the fourth most common cause of acute abdomen. The prime diagnostic concern when the thick wall gallbladder above the 3 millimeters at imaging. This feature is not pathognomonic, and additional imaging signs should be present to support the diagnosis of acute calculous cholecystitis, such as obstructed gallstone, hydropical dilatation of gallbladder, positive sonographic Murphy sign, pericholecystic fat inflamed or fluid. هاي طبعا تنشاف بالسيتي ما تنشاف كلش قوية بالأمر. Hyperemic of gallbladder wall and power Doppler. Many classification of cholesterol تتضمن عندنا 3 types اللي هي الكوليسترول 10%, mixed 80 وpigmented stone 10%. Cholesterol هي more than 50% cholesterol content from supersaturation of bile, nucleation, and stone growth. Predisposing factor: diet, sanitary lifestyle, and rapid loss of weight, obesity, oral contraceptive pills, total parenteral nutrition, ethnicity and genetic predisposition, older age, and female sex. الميكس تايب اللي هو أكثر شيء 80% 20 إلى 20 to 50% of cholesterol content, predisposing factor similar of cholesterol stone. Pigmented اللي هي 10% قلنا عليها أقل من 20% cholesterol content, high bilirubin content, and occur when there is supersaturation of unconjugated bilirubin. Another classification for gallstone تضمن 2 further subtype, each of them for a predisposing factor: a black pigment or brown pigment. نعم أستاذ. البلاك بيجمنت ستون اللي هي chronic hemolysis, liver cirrhosis, intestinal malabsorption تضمن Crohn's disease, brown pigment stone, bacteria and parasitic infection, and biliary stasis. نيجي على complication اللي هي biliary colic abdominal يعني بين cholecystitis, acute cholangitis, pancreatitis. 35 to 40% of gallstone causes pancreatitis, obstructive jaundice, gallbladder emphysema, gallbladder hydrops, mucocele, cholecystoduodenal fistula leading to the gallstone ileus, or Bovar syndrome اللي هي gastric outlet obstruction, Mary's syndrome, dilatation of intrabiliary duct, increased risk of cholangiocarcinoma, separation multiple. هنا أنا ناخذ CT و MR نشوف الفرق بها. Gallstone better seen on MR. This is axial contrast enhancing CT image on the right side. A normal appearance of gallbladder, no stone. Of the same patient, however, axial T2 weighted MR image performed for further evaluation of another abnormal demonstrate multiple small gallstone were undetected by CT. طبعا الدنسيتي مال هاي الستون هي موجوده بالجول بدل نفس الدنسيتي مالت البال، فلذلك لما طلعت عندنا بالسيتي شفناها احنا بالامار. Another case, gallstone more visible on MR. Contrast enhancing CT single hypodense filling defect in the gallbladder is consistent with gas filling gallstone. On left side اللي هي T2 axial weighted MR of the same patient demonstrate multiple additional gallstone which were isodense to the bile on the corresponding CT image filling of the gallbladder. هاي نفس الحالة هم عندنا وحدة اللي شفناها بالCT ومن سوينا له MRI لقينا أكثر من ستون موجودة اللي هي طبعا نفس الدنسيتي مالت البايل. نجي هسه على الدروب gallstone complicated by abscess formation. هاي complication. Axial contrast enhancing CT show a small regulated fluid collected posterior liver margin of the right lobe of the liver consisting with abscess. Spilled gallstone arrow is seen within the abscess. طبعا هنا اكو كيرسر موجود، هاي الجولستون وهاي الفلويد اللي موجوده. Axial contrast enhancing CT image show inflammatory changes in the perihepatic fat posterior to the liver. Cholecystectomy surgical eclipse موجودة. Gallbladder abscess associated with drop gallstone are usually treated by surgical rather than percutaneous drainage to remove all gallstone, which can be act as a nidus for recurrent infection. each حالة drop gallstone يحتاج لها إنه تنفتح ثاني مرة open surgery و evacuate الستون، يعني ما ترام لأن percutaneous evacuation. هنا نشوف ultrasound with CT scan اللي هي layering thickness of gallbladder, stone, bile sludge. Now the CT inflamed fat around with thickness of gallbladder. Now الماكسيموم طبعا intensity مالتها وهاي الانفلاميت مالت الفات around. هاي الفيتشر مال cholecystitis acute cholecystitis. نجي هسه على الريجولار سترايد اللي هي ثلاث شغلات: small bowel obstruction, gas in biliary tree and large ectopic gallstone. هنا بالبلين اكس راي نشوف هنا عندنا غاز موجوده بالليفر، وهنا dilatation مال الباول، وهنا الاكتوبيك gallstone. Coronal axial coronal CT scan showing dilated of small bowel, gallstone and gas in the inside the liver. هاي يسموها regular triad. Acalculous cholecystitis. Acute acalculous cholecystitis mainly occur in critical ill patient, presumably due to the increased bile viscosity from fasting, medication. The imaging feature are those of acute cholecystitis except for absence of stone. يعني نفس الفيتشر مال acute calculus بس ما موجود بيها stone. Because in a critical ill patient gallbladder abnormality are frequently found secondary to systemic disease. Acalculous cholecystitis can be difficult to diagnose in these patient percutaneous. في هذه الحالة لازم نسوي لهم فد cholecystectomy can be both diagnostic and therapeutic، يعني يسحبون الجسم. Reported cases أنا طبعا شفتها بأحد البحوث. Reported cases of acalculous cholecystitis تتماشى هي إنه إذا عند البيشنت viral hepatitis A يجي وياها acute pancreatitis و cholecystitis اللي هي without stone. 74 years old man with acute acalculous cholecystitis. Left here ultrasound at the spot of maximum tenderness, showing a mural thickening of the gallbladder that's completely filled with sludge without any stone. Right here, power Doppler sonography show hypervascularity of gallbladder wall as supporting sign of inflammation. هاي هي gallbladder filled with sludge، عندنا thickness بس ما نشوف أي stone، يعني بس مجرد inflamed. وهذا البايل سلج مال starvation. سوينا على باول دوبلر لقينا كوفة هايبريميك وول اللي هي من الاديماتس. Chronic cholecystitis is a term used clinically to refer symptomatic gallbladder stone that causes transient obstruction leading to low-grade inflammation and fibrosis. يعني اكو stone بس inflammatory process تكون slowly leading to the fibrosis of gallbladder. Correlation to the imaging finding of stone containing slightly thick wall gallbladder with the clinical history is critical. هاي الكيس مالتنا اللي هي ultrasound. stone شفنا موجودة، small gallbladder size مالتها small with thickness of the wall. هاي chronic cholecystitis. Bile sludge commonly seen ultrasound and appear as a fine non-shadowing dependent echo، يعني وين المكان اللي يتجمع بالجرافيتي يوصل بيه. It is more commonly seen in a chronic fasting state, critical ill patient, those receiving total parenteral nutrition and in pregnancy. Sludge resolves spontaneously in 50% of patients, and gallstone will develop in 5 to 15% of case of the bile sludge. Small stones are difficult to locate within the sludge مثل ما شفناها بالبداية على الCT والMRI إنه شلون detected. So careful imaging through the sludge is important. Usually sludge layers is dependent fashion but occasionally it mimic tumor mass اللي هي tumor effective. اكو الفيتشر مالت السلاج اللي هو يتحرك يعني ويا الجرافيتي مالته، بس التومو افكتيف سلاج تكون ستيك على المكان واحد. Sludge can be usually differentiated from a tumor by its mobility, lack of internal blood flow on Doppler examination, and lack of focal gallbladder wall abnormality اللي هي thickness infiltration or lack of enhancement on contrast enhancing ultrasound. Blood hemophilia and pus impairment maybe have similar appearance to the sludge. And the clinical setting aid in the differentiated sludge blood pus can also occur in the bile duct and inside liver. Now ultrasound imaging showing gallstone ونشوف اللايرنج مالتها on dependent parts لأن هو البيشنت نايم supine فهتكون هي له posterior. هنا كلها fault the gallbladder bile sludge. Milk of calcium bile or limy bile is an uncommon condition in which the gallbladder bile becomes viscous probably as a result of stasis and containing high concentration of calcium bilirubinate. On ultrasound, it causes diffuse echo similar to the sludge, but small echogenic with tendency to layering out and produce acoustic shadowing. On CT and occasionally on a plain radiograph, it's visible as layering high density material. هنا نشوف axial CT scan layering of high density fluid بالgallbladder اللي هاي لايمي. هنا كذلك on dependent part هاي شوف اللايرنج مالتها. كلش واضحة صار؟
واضحة.
نعم. Xanthogrammatus cholecystitis is unusual variant of chronic cholecystitis characterized by lipid-led inflammatory process. Imaging studies show marked gallbladder wall thickened, often containing intramural nodule that are hypoechoic on sonography and hypoattenuation on CT. مثل لك هي abscess or foci of xanthogrammatus inflammation. These features overlap with those of gallbladder carcinoma, making preoperative distinction between these entities often impossible. طبعا xanthogrammatus هي تشابه ويا الgallbladder carcinoma، بس ليش تفرق انه هي infiltrative كلر دوبلر تشتغل وياها ممكن او بالكونتراست تختلف. هنا عندنا CT contrast with ultrasound imaging. Xanthogrammatus cholecystitis ultrasound show mark wall thickened with intramural hypoechoic nodule and intraluminal stone. هنا نشوف هاي النودول اللي هي intramural وانتاك طبعا الاوت والان، وهنا نشوف اكو stone. Contrast enhancing CT show deformed and thickened gallbladder wall containing hypoattenuating nodule. هنا أنا بالكونتراست CT نشوف هاي hypoattenuating nodule intramural. Porcelain gallbladder is a rare disorder with chronic cholecystitis produce mural calcification. In this patient, prophylactic cholecystectomy has been advocated because associated with gallbladder carcinoma. طبعا هو هذا الاسوشيت يكون كلش ويك بس يعني هم انه cholecystectomy يسوي له. هنا عندنا ultrasound والبلين X-ray showing round calcified، وبالالتراساوند نشوف الوول مالته calcification with posterior shadowing اللي هي porcelain gallbladder. هاي شايفينها طبعا الساد. Gangrenous cholecystitis, irregularity or asymmetrical thickening of the gallbladder wall, internal membranous echo resulting from sloughed mucosa and pericholecystic fluid. CT signs suggesting gangrenous cholecystitis أولاً gas in the wall or lumen. ثانياً discontinuous or irregular mucosal enhancement اللي هي internal membrane. 3. Pericholecystic abscess. Of this interrupted wall enhancement is the most sensitive sign 70% and highly specific 100%. إذن هي interrupted wall هو أكثر sign نعتمد عليها هنا حتى نقول عليها high gangrenous cholecystitis. Occur in 5 to 10% of patients with acute cholecystitis. It's suggested by pericholecystic fluid and the feature of gangrenous cholecystitis. Localized disruption of the gallbladder wall is seen on ultrasound as a 40%, on CT 80%. Less often generalized peritoneal fluid may be present. Contrast enhancement ultrasound can help identify perforation by showing local absence of gallbladder enhancement. هنا هي نشوف الالتراساوند imaging gangrenous cholecystitis in 44 years old female. Ultrasound imaging showing gallstone impacted at the neck resulting in distended gallbladder with wall thickened sloughed membrane within the lumen in case of gangrenous cholecystitis. هاي هي الgallstone at neck impacted، وهنا عندنا sloughed membrane gangrenous cholecystitis. ها هنا الكيس الثانية اللي هي CT ماخذينها portal phase CT scan showing incomplete mucosal enhancement with distended gangrenous gallbladder pronounced pericholecystic fatty inflammation. هذا هو الوول entrapped هنا وكوها inflamed fat around. Emphysematous cholecystitis 1% of acute cholecystitis but has relatively high mortality rate. More common in men, 50% diabetics, stone are present less than 50%. Diagnosis may be evident on a plain radiograph and straightly made on CT, which show intramural and intraluminal gas caused by gas-forming organism. Ultrasound intramural gas appear as a focal or diffuse bright echogenic light dirty shadow طبعا يعطي. Small foci of intramural gas may cause ring down artifact mimic adenomyomatosis. Now a plain X-ray showing intramural as well as intraluminal gas. High intramural. Will CT coronal intramural gas also seen. Now ultrasound شوف هذا الهايبريكويك line with dirty shadowing. نجي هسه على الموضوع أهم اللي هو gallbladder polyp. The great majority of polyp are composed of cholesterol اللي هي 90% and less often are adenomatous. Cholesterol polyp are usually 2 to 10 millimeter in size. Cholesterol polyp هذا. Whereas adenoma can be up to 2 cm. They both appear as a small echogenic non-shadowing foci adherent to the gallbladder wall, often in non-dependent portion. عكس اللي شفناه بالbile sludge. Lack of mobility favor polyp rather than stone. True malignant polyp are rare. Doppler flow within the echogenic lesion differentiated it from the sludge, but doesn't distinguish reliable between the benign and malignant. Contrast enhancement ultrasound show promise and differentiate malignant gallbladder from the benign polyp by demonstrating wall destruction and rapid washout. CT is significantly less sensitive for detecting polyp compared to the ultrasound. It may not be possible to detect polyp from non-calcified gallstone on CT. MR polyp are low in signal on both T1 and T2 weighted image. Both benign and malignant polyp may show early enhancement. However, on 5-minute delay imaging, malignant polyp tend to demonstrate prolonged enhancement, whereas benign show washout. Differentiated between the benign and malignant feature للpolyp, size مالته. Polyp that are less than 5 millimeter in size are almost always cholesterol polyp. 5 to 10 millimeter polyp may be warrant follow-up to ensure non-interval growth. Size مالت المalignant اللي هي أكثر من 10 مليم يعني 1 سنتيم 62% are malignant. Morphology بالbenign تكون pedunculated يعني هيجي طالعة. بالmalignant تكون sessile يعني broad base. Numbers more than 50% of cholesterol تكون multiple. بالmalignant تكون solitary. الجروث stable growth بالbenign أما الجروث بالmalignant تكون interval increase in size. CT MR enhancement similar to the rest of gallbladder wall and ultrasound feature small echogenic foci or cluster of foci comatial artifact اللي هي cholesterol. CT MR enhancement المalignant greater than the normal gallbladder wall تكون أكثر enhancement من عدة البقية. أكو يعني different بيناتهم. Treatment and prognosis. Polyp more than 10 millimeter increased risk of malignancy. Cholecystectomy is recommended. Polyp less than 10 millimeter if the patient has risk factor for gallbladder malignancy. Polyp less than 6 millimeter. Follow-up ultrasound at 6 months, then yearly for 5 years. An increase in size more than 2 millimeter, consider cholecystectomy. Polyp more than 6 millimeter, consider cholecystectomy. هذا risky. No risky factor for gallbladder malignancy. Polyp below the 6 millimeter follow-up ultrasound at 1, 3, 5 years. Polyp more than 6 millimeter follow-up ultrasound at 6 months. Then yearly for 5 years. إذا صار زيادة أكثر من 2 millimeter, consider cholecystectomy. Ultrasound وهاي الإيمج الثاني اللي هي contrast enhancement ultrasound. Enhancing of the lower part of the gallbladder and the arterial face. أكو enhancement صاير ويا البوليب. هاي طبعا هو الاتاتشمنت مالته at non-dependent part. هذا هو dependent part وهذا non-dependent. بعد شوية نفرق بين البile sludge or stone. In enhancing CT showing marked enhancement of the polyp in the fundus of the gallbladder. Intraoperative ultrasound showing mushroom-shaped polyp with hyperechoic spot in the surface with inner echogenic area. Now enhancement CT enhancing polyp. وهنا gallbladder ultrasound نشوف هاي pedunculated mass. هنا ماخذين الدوبلر with the CT. Color Doppler for the polyp vascular from the base. CT scan venous face اللي هي partial enhancement at the periphery. أكو بالperiphery partial enhancement يعني مو كلش قوية. XCLT to reveal a aware marginated lesion inside the gallbladder اللي هي villus morphology. شلون fungating finger like. No evidence of wall thickening or stone in the gallbladder يعني polyp. نيجي هسه على gallbladder carcinoma. Is the fifth most common malignancy of GIT tract and is found incidentally in 1 to 3% of cholecystectomy specimens. 90% are adenocarcinoma and remainder squamous cell carcinoma. More common in elderly women. It's often detected at late stage of disease due to lack of early or specific symptoms. Gallbladder carcinoma has a various imaging appearance ranging from polypoid intraluminal lesion to infiltrated mass replacing the gallbladder. It may be also present as diffuse mural thickening. Features of advanced disease include intrahepatic biliary dilatation, invasion of adjacent structure, lymph node, peritoneal carcinomatosis, hepatic and other distance metastasis ممكن يصير. Diagnosis: ultrasound can detect a focal intraluminal wall involvement or large mass-like lesion replacing the gallbladder. Usually has irregular and sometimes ill-defined margin with heterogeneous ecotexture and predominantly low echogenicity. Hyperechoic foci with posterior aquastic shadowing may be seen within the mass, possibly reflecting gallstone, يعني mass engulfing the gallstone, or gallbladder wall calcification, porcelain gallbladder اللي هي predisposing factor for gallbladder carcinoma. CT scan, typically gallbladder adenocarcinoma, appear as large heterogeneous mass, which may have engulfing gallstone or area of necrosis. Patchy moderate contrast enhancement is usually seen. Dynamic MR is considered useful and reliable in staging of advanced gallbladder carcinoma. MR combined with MRCP is sensitive in detecting of obstructive jaundice and liver invasion as well as hepatic lymph node metastasis. It may be more difficult to delineate any invasion to the duodenum or detected omental metastasis by MR. Gallbladder carcinoma ultrasound show marked generalized wall thickening, replacing the gallbladder lumen. Multiple gallbladder stone indicate the probable location of the fault lumen. لهذا هو الوال مالته 9 stone while invasion مالته. Contrast enhancing CT depict a thick wall gallbladder with local infiltration of the mass to the adjacent. هنا هي هاي الgallbladder thick wall ونشوف هنا ال adjacent اللي هي liver parenchyma invasion by the tumor. Another entity, adenomyomatosis, is gallbladder characterized by epithelial proliferation, muscular hypertrophy, and intramural diverticuly. اللي هي ريكتينسكي اشكوف ساينسز. التايبس مالته 4 انواع اللي لقينا بها اللي هي fundal, segmental, annular and diffuse. هاي هي قدامكم. fundal. هاي هنا عندك segmental وهنا الانيولار وهنا diffuse. It's a benign condition that requires no specific treatment, occurring incidental finding up to 9% of cholecystectomy specimen. Sonography finding of cholesterol crystal show common-tail revibration artifact within the thick wall of the gallbladder strongly suggested diagnosis. Air may produce similar artifact. Patients with emphysematous cholecystitis are usually ill in contrast to those of adenomyomatosis. MR imaging may be able to differentiate adenomyomatosis from the gallbladder carcinoma by depicting of the sinuses. MR should be reserved for cases that are unclear on ultrasound and contrast enhancement. MR can be identified the extremely high sensitive sinuses, but their signal intensity varied widely according to their content. ممكن الروكتينسكي تحتوي لك على مثلا بروتينات او بس فلويد فالدنسيتي مالتها تختلف. PET scan may be helpful for excluding malignancy. CT scan and cholangiography are not routinely indicated in the suspicion of gallbladder adenomyomatosis. هنا ultrasound for segmental thickening للادينوميوماتوسيس نشوف هنا segment بس. Adenomyomatosis in 39 years old female. Ultrasound show mural thickening with calcification, characteristic of common tail revibration artifact بسبب small cholesterol crystal. هاي هو revibration common tail. هاي كلش واضحة هنا. هنا نستخدمه الكالر دوبلر حتى يشوفون الريفايبريشن تطلع هيجي، يعني هو يطلع لون بلون احمر ازرق احمر ازرق، وهنا السكيل مالته حاط وياه الوان ثانيه. هاي هي الاشكوف ساينس، وهنا شلون طالعه ريفايبريشن ارتفاكت. هنا مستخدمين الام ار اللي هي اوبليك فات ساتوريتد ام ار كولينجيو بنكرياتوغرافي ايميجينج فيجواليز ا فيري سمول سيستيك ستراكشر اللي هي فندس، اللي هي الدايجنوستيك نشوفها بالام ار ادينومايوماتوسيس نفرق عنها. secondary gallbladder wall involvement. Systemic disease such as hepatic dysfunction, heart failure, renal failure lead to the diffuse gallbladder thickening. Exact pathophysiology mechanism leading to the edema of gallbladder wall. This diverse condition is uncertain. بس ممكن الكوز ان نحصرها elevated portal venous pressure, elevated systemic venous pressure, decreased intravascular osmotic pressure, or a combination of these factors. رابعا hyperproteinemia hypothesis and disputed. Liver cirrhosis, hepatitis, congestive heart failure are relatively frequently causes. أكثر شيء يعني. 56 years old man liver cirrhosis, ultrasound detected wall thickened, surrounded by ascites, irregular cirrhotic liver parenchyma. هنا نشوف تقريبا small size liver, irregular outline, ascites, thick wall. يجي ببالنا انه هذا liver cirrhosis سوى الكولسيستايتس اللي thickened gallbladder العفو. Contrast enhancing CT of the wall of the gallbladder appear as nearly normal because of subserosal edema cannot be well differentiated from the surrounding edema. وطبعا هو thick نفس الكيس هاي thick بس بسبب الاديماتس اللي هنا صايره رايحه الوول مالتها. Congestive right heart failure. 74 years old man with congestive heart failure, ultrasound detect diffuse wall thickening of a stone-free painless gallbladder, a large caliber hepatic vein and inferior vena cava supporting evidence of right heart failure. ما عنده أي sign symptom of acute cholecystitis أو calculus, wall thickness. وهنا نشوف dilatation of IVC والintrahepatic. هاي عاد سنة إنه هذا هو congestive heart failure. Extra cholestistic inflammation may secondary involve the gallbladder causing wall thickening due to direct spread of the primary inflammation or less frequently due to the immunological reaction. It may be caused by any inflammation that extends to the region of the gallbladder, but only few are regularly encountered, including hepatitis, pancreatitis, pyelonephritis, اللي هي right side. Gallbladder wall thickening also has been reported in patients with infectious mononucleosis and in patients with AIDS due to opportunistic infection or secondary neoplastic infiltration. هنا هذا CT contrast enhancement of pancreatitis. Contrast enhancement show peripancreatic inflammatory changes and thickening of the wall of gallbladder, secondary involvement of the pancreatic inflammation. يعني كيس مال pancreatitis هذا هو البنكرياس وهذا الانفلام بأمتم اللي بسببه صاير هاي الثيكنس مالت الجallbladder. Metastatic disease to the gallbladder is infrequent and usually occur in the setting of widespread metastasis. Most common malignancy metastases to the gallbladder include melanoma, lung cancer, renal cell carcinoma. هاي الكيس هي مالت melanoma اللي نشوفها intraluminal polyp of soft tissue arising from the gallbladder wall. نجي هسه على الميتاستاسيس gallbladder from the RCC اللي هي axial non-contrast image show intraluminal soft tissue mass arising from the gallbladder fundus. الايمج الثاني اللي هي الكونتراست نشوفه ايفتلي انهانسمنت. هاي طبعا فيتشر مالت الار سي سي. ثانك يو.